All right, everybody. Hi there. Good morning. It's Dr. Arafij from Vet Triage, November 5th, 2024, 9:05 a.m. Pacific time. We're going through this issue of JAVMA here, which is the May 15, 2018 issue. And we're looking at this study, evaluation of various gastrojejunostomy tube constructs for enteral support of small animal patients. So this is a feeding tube evaluation. That's what enteral means feeding the intestines. And gastrojejunostomy means that the tube will go through both the stomach and the jejunum. So you'll have to have some basic knowledge of anatomy for this, but nothing that I'm sure you folks can't handle. They compared using tap water, a commercial enteral diet, and 2 different canned food water mixtures. What they found the results is that the 5 French jejunostomy tube allowed only for water to be injected. The 8 French jejunostomy tube, which we're going to call J tubes from now on, did not allow injection of canned food mixture. The 20 French gastrostomy tube, we're going to say G tube, and 10 French J tube construct did not allow for injection or aspiration through the G tube. So just real quick, when we have these 2 sizes, 20 French / 10 French, the first number is G tube, second number is J tube. And the reason for that is the idea behind these tubes that the bigger bore G tube, which goes into the stomach, right? You're passing inside of that the J tube, which will go into the jejunum. So if you imagine now, here's the stomach, let's say, the tube is in there, right? That's the G tube. And that's where the G tube stops because it's meant to feed the stomach. The J tube keeps going into the jejunum. And so you can feed the patient through the stomach or jejunum or both, depending on what you're trying to do. And you can also aspirate. You can also remove food or fluid or whatever from those tubes as well. So that's what they're comparing here, just so folks understand. Not a lot of veterinarians even use gastrojejunostomy tubes. And so here we are. Okay. So the 20 French G tube, 10 French J tube did not allow injection or aspiration through the G tube. The 18 French G tube and 8 French J tube allowed injection but not aspiration to the G tube. Faster flow rates through the G tube was associated with larger G tube diameter, and the smaller J tube diameter was also associated with faster flow rates through the G tube. And there were similar and smaller syringe size also resulted in faster flow rates with the G tube. Faster flow rates through the J tube were associated with smaller J tube diameter. Conclusion was results suggest that homemade gastrojejunostomy constructs would allow for administration of various enteral diets. So this, you can already tell, this is going to be a bit difficult to read and display on video. This is one of those articles that's better just to read it, but we'll just go through it. And the summary at the end is quite concise and actually very useful for folks who are considering this, but we'll just go through the study. Okay, introduction. J tubes, G tubes, and E tubes, so esophagostomy tubes, are very common. We use them for pre-pancreatic, also known as gastric feeding, or post-pancreatic, which is jejunal feeding. And ideally, you'd want to feed those areas of the body with one port, single access option. Measuring gastric residual volume may help prevent complications such as regurgitation, aspiration pneumonia, resulting from poor postoperative gastric motility, because these tubes require surgery to place. So a J tube through a G tube, which is a gastrojejunostomy tube, are currently expensive, and with human patients, they are too large. J tube and G tube in the same body wall and gastric incisions have been suggested. So instead of having 2 tubes within each other, you put 2 tubes simultaneously next to each other. But this study wants to look at a cheaper option for gastrojejunostomy tubes. Materials and methods. They use J tubes that were sized as 5 French, 8 French, 10 French. G tubes were sized at 18 French, 20, 24, 28. And the combinations were 18/5. Again, remember the first number is G, the second number is J. And easy way to remember this is the G tube will always be bigger because the stomach gets fed first. So 18/5, 18/8, 20/5, 20/8, 20/10, 24/8, 24/10, 28/8, and 28/10. 20/10. Okay. Enteral feeding solutions and syringes. They used tap water. They used a commercially available enteral diet. They used a 1-to-2 ratio of canned food and water blenderized, and they used a 1-to-1 ratio of canned food and water blenderized, 22-degree temperature. 3 syringes, 20 ml, 35 ml, and 60 ml were used. This is a picture. A shows them using a scalpel blade to make a hole. That little green tube in A is the J tube going into the G tube. Okay, so that's what you have to picture in your mind with this study. Enteral feeding solution administration and aspiration. Each ease of injection or aspiration of solutions were scored on a scale from 1 to 3. 1 was easy passage. 2 was it passed, but there were some difficulties. 3, passage was not possible. Leakage at the interface between J tube and G tube was scored, and it was largely absent. Ease of filling and emptying the 3 sizes of syringes were also scaled from 1 to 3. Okay, results. Leak testing and subjective assessment of filling and emptying syringes. So the 60 ml syringe was more difficult to empty and fill than the 20 or 35 ml, especially with both canned diet water mixtures. Now, J tube injection. Water passed easily through the 5 French J tube. Water and the enteral diet passed easily through the 8 French with all 3 syringe sizes. 2 canned food water mixtures through the 8 French J tube was not possible. Injection was easy for all 10 French J tubes for all 4 feeding solutions in all syringe sizes. So what that tells you is the larger the J tube, the more thick the solution you could fit, which, obviously. Now looking at the flow rate of water. The flow rate of water of the 5 French J tube was slower than the 8 French and the 10 French. The flow rate of the 8 French was slower than the 10 French. The flow rate when using a 60 ml syringe was slower than when using a 20 ml syringe or a 35 ml syringe. There was no difference between 20 and 35 ml syringe. So what you can take from there is that the the smaller the J tube diameter, the slower the flow rate, and the larger syringe was slower than the smaller syringe. Then flow rate of the enteral diet. Flow rate through the J tube was significantly faster for constructs with a 24 French G tube than for constructs with the 18 French G tube, and slower for constructs with a 24 French G tube than for constructs with a 28 French G tube. Flow rate for the 10 French J tube was faster than the flow rates of the 5 French and 8 French. Flow rates when using a 60 ml syringe was slower than when using the smaller syringes. Now, flow rate of the thin canned food/water mixture. The flow rate was faster when you used a 35 ml syringe than a 60 ml syringe. Flow rate for the thick canned food water mixture. Flow rate through the J tube was slower with an 18 French G tube than for constructs of G tubes of any other size. Flow rate was also slower for a 5 French than the 8 French J tube or the 10 French J tube. Flow rate when using 60 syringe was slower than using a 20 or 35 ml syringe. Now for G tube injection. None of the solutions injected through the G tube of the 20/10 construct was possible. All constructs other than the 20/10 were assigned an ease of injection score of 1, except for the 18/8, which was assigned a score of 2 for the thick mixture and a score of 3 for the score of 2 for the thin mixture, score of 3 for the thick. Flow rate of water. G tube was faster with a 5 French J tube than for constructs with a 10 French J tube. Flow rate of water through G tube was increased with increasing G tube diameter and syringe size. Next is flow rate of enteral diet. Flow rate for constructs with a smaller G tube was slower. 18 French and 20 French G tube were slower than the 24 French, and that was slower than the 28 French. Flow rates through G tube for constructs with a 5 French or 8 French J tube were faster compared with flow through the G tube for constructs with a 10 French J tube. Flow rate injection through the G tube was significantly slower when using a 20 ml syringe than when using a 60 ml syringe, but not when using 35. 35 and 60 did not differ. Flow rate, next is flow rate of the thin food water mixture. Flow rates for 24 and 28 French G tube were faster than the flow rate of 18 and 20, so the larger tube was faster. Flow rate through the G tube with a 5 or 8 French J tube was faster compared with a G tube with using a 10 French J tube. There was no significant difference between flow rates of constructs with a 5 and 8 French J tube. Flow rate of injection through the G tube was faster when using the 35 and 60 ml syringes versus the 20 ml, but flow rates of 60 and 35 did not differ. Next subject, flow rate of the thick canned food water mixture. Flow rates for 24 and 28 French G tubes were faster than flow rates of 18 and 20, so larger tube were faster. Flow rates of the G tube with a 10 French J tube was slower than flow rates through a 5 or 8 French J tube. So what this is all saying is if you have a larger J tube, which is inside the G tube, then it's going to slow down the rate of flow in the G tube. It makes sense, right? Because more J tube is taking up space in the lumen of the G tube. That's what all this is saying. I'm just going through it just to be thorough. Flow rate through the G tube when using a 20 ml syringe differed significantly from the 60 ml syringe, but not from the 30. Flow rates of the 35 and the 60 did not differ. G tube aspiration. None of the solutions, including water, could be aspirated through a G tube 20/10. Similarly, aspiration of the enteral diet through 18/5 was difficult, as was aspiration of both canned food water mixtures to the G tube of 20/8, especially with 60 ml syringe. Now, when assessing flow rate of water, flow rate during aspiration to the G tube 28/8 was faster than others, whereas the flow rate of the 18/5 was slower than others. Flow rate of the enteral diet, flow rate through the G tube 18/8 was slower than the flow rate through others. Flow rate using the 20 ml syringe differed significantly when using the other two syringes, but 35 and 60 did not differ. Next is flow rate of the thin canned food water mixture. The overall model for flow rate for the thin mixture during aspiration through the G tube was significant, with G tube diameter and J tube diameter significantly associated with flow rate. And then finally, flow rate of the thick mixture. The overall model for the flow rate of the thick mixture during aspiration, the G tube was significant, with G tube diameter, J tube diameter, and syringe size all being associated with flow rate. Okay, finally, discussion. Large diameter G tubes and smaller diameter J tubes were associated with faster flow rates through the G tube. So larger G tube and a smaller J tube meant that the G tube would be faster, which we knew because that's, like I said before, the J tube diameter, the smaller it is, the less occlusion you're going to have in the lumen of the G tube. Larger J tubes were associated with faster flow rates to the J tube. Makes sense. If it's a larger tube, you'll have faster flow rates. Generally, syringe size was not significant, but the 60 ml syringe may have been more difficult because it was somewhat dependent on hand size. A 60 ml syringe is very large. So that may explain why there was such a difference between that syringe and the others. Only water could not be injected through the 5 French J tube in the present study, making this an ineffective option for post-pancreatic or jejunal feedings. So you need a larger J tube for smaller patients, or a very dilute enteral solution or parenteral nutrition solution should be used. Parenteral means outside of the intestine, so usually injection, like PPN or TPN. No solution could be injected or aspirated through the G tube of the 20/10. The outer diameter of the J tube was similar in size to the inner diameter of the 20 French G tube, making this combination inappropriate for use. The J tubes were easily to remove. The constructs allowed for simultaneous aspiration of the G tube while feeding through the J tube. That's the coolest part about this, because there are cases where the stomach is not moving well and you want to empty the stomach to prevent nausea and things like that, aspiration, but you still want to feed them. And so you want to bypass the stomach to feed them. It's very cool. The constructs used here cost $45 to $50 per construct, whereas the commercial ones are $109. So they achieved their goal by creating constructs that were more affordable with a bunch of different varieties depending on the case itself. You can decide. They admitted that they use it on small animals. So large animals, it may differ as far as what the utility is. But you can imagine if you can't use a tube, it's too small for a small animal, you're not going to use it on a large animal anyway. So that's it for that study. It's a complex one. Thanks for sitting through it. Hopefully it was useful for you folks. We'll see you again tomorrow. Bye.